Hi, I'm Gerry Stark. I'm with Professional Clinical Services with Ottobock, and we actually have the Option 3 LSO lumbosacral orthosis. We're going to be fitting that today to our patient. I hope you're doing well. So there's a couple of things you can do to resize this device. It gives you those options. So what you can do is resize the straps on the side by tucking or folding them in, or if you want to decrease bulk, you can actually use a scissors. You have your lateral supports as well, and you can pre-contour or heat mold the posterior and anterior panels. Another thing to remember is this device gives you a lot of adjustability. So there's also an extra large size. We've pre-sized the device. We're actually ready to apply this to our patient. And so we'll actually have you stand to the side. And what we want to do is find the inferior position of the orthosis and the sternal or the sacral notch. And we'll place that into position, and we'll have it a little bit lower than we're used to. And we'll have the patient pull the left strap down tight and then the right strap over top. I'll actually hold this and compress, right? And then I check the overall position. Sometimes when they're standing, they'll position it too far superior. And so we'll have her turn to the side, and then we'll actually have you hold your breath a bit and then pull the string adjustment anterior. We call this the kite string, and she'll pull that as tight as she can hold it without feeling that she's too enclosed or having difficulty breathing. Do you feel comfortable? Good. And that's the fitting of the Option 3 LSO. Okay, another way to fit the Option 3 LSO is actually in the supine position. This has certain advantages because in the supine position you can achieve greater intercavitary pressure and contact with the lumbar area. You do this again by sizing the device. We have our panels on the side, which can be sized or cut or folded. We have our lateral pads. We have our posterior and anterior reinforcement panels, which can be heat molded as well. So what we'll actually do is position this on the patient in the supine position or on their back. So we'll position the patient, she'll lay down. And again, this is usually if someone is in a significant amount of pain or where standing is more difficult for them. So we'll have the patient roll toward the side, and you must be very careful they don't roll over the bed. And we'll pull the straps out of the placement. We'll place the inferior area near the sacral notch. She'll roll toward me, and then she'll roll toward me again. And we'll position this from this side, bring the strap around to the front. And now she'll go back to her back, and she'll actually help me a bit. We'll place the left strap down first, the right. Does that feel nice and tight? And then I'll actually have you put your arms above your head and then breathe in, and we'll get this as tight as we can. Now, does that feel like you can breathe easily and you're comfortable? And then we'll secure this in position and swing your legs to the side. And then we look at overall position. We make sure that we're close to the sacral notch and that the inferior lateral placement is in the intertrochanteric area. And we're ready to have the patient go on from this moment. Thank you.